All right, let's continue with part 2. And here we're going to discuss the second certifying body and take a look at the 2 certifications that the National Board offers. And so a little bit about the certifying body, the NBCMI. So in their website, they state that the purpose of CMI certification, which as I mentioned are 2, the first one is the CMI and the second one is the HubCMI, and we'll take a look at each individual one. Is to ensure that the standards met are necessary for safe and ethical practice of the medical interpreter profession. So that's the purpose that they seek to fulfill with having this certification program. They consider it a careful vetting process and believe that they have high standards held by the National Board. So then someone who passes their exam is going to be knowledgeable and able to meet the regulatory guidelines, complete accurate interpretation, and promotes patient safety. So the reason why I mention this information for both exams is because that gives you a little bit of information on what it is that they are going to test you on, right? So here from this statement you can see that they want you to prove that you are familiar with the standards of practice, that you are going to be interpreting ethically, completely, accurately, that you know about patient safety and standards of practice. So let's take a look further at the exams. So as I mentioned, there are 2 credentials offered by the National Board of Certification for Medical Interpreters, the HubCMI, which is available for all languages, and the CMI, which is available for Cantonese, Korean, Mandarin, Russian, Spanish, and Vietnamese interpreters. And quick look at the requirements for both exams. So just like with CCHI, we see that you have to be at least 18 years old. You have to have earned the equivalency of a high school diploma or a high school diploma. So a GED would be fine, or a high school level education in another country. In this case, you do have to upload a profile photo for the CMI and HubCMI, and the requirement for interpreter education is going to be pretty similar to CCHI. So candidates must submit proof of training specific to medical interpreting, and here at the bottom you can see that there are 2 ways that you can show that. So first is through interpreter training or education at a college or university, and you can see here that it says that 3 units is enough, so that's why I mentioned that HCI 310 would help you meet that requirement. And the second way is through a medical interpreter training course that is at least 40 hours, and then you have to submit a certificate of completion, and it can't just be any course, it has to be one of the ones that is on their list of approved courses, and that is going to be found, a list of those is going to be found in their candidate handbook. Okay, so let's take a look at the HubCMI, and the HubCMI is going to be the one that is available for interpreters of any language, and the purpose of this is to establish mastery of medical terminology and specialties, cultural competencies, ethical judgment, and then a baseline level of competency, fundamental knowledge in the medical interpreter profession, and this is a written exam that does not carry a language distinction. So this again is not going to mention what language you are because it's available for all the languages, and you do have to meet a language proficiency criteria, and this is considered the preliminary credential that you can be granted while you're earning the CMI. If you are an interpreter who speaks Cantonese, Korean, Mandarin, Russian, Spanish, and Vietnamese. This is a preliminary or the very first step in the credential process. But if you don't speak one of these 6 languages, then this is as far as you're going to go with this credential. Okay, so if you do speak Cantonese, Korean, Mandarin, Russian, Spanish, and Vietnamese as a language of service, then you do take the second part, which is the CMI, and that is going to be an oral exam-based credential. It does have a language designation, so when you receive that credential, it will mention what language you speak or what language you interpret into. And this, of course, does carry a assessment with an oral exam to be sure that you do speak the language. Okay, so this is information that I'm going to leave here for you as well, and it's going to have a link to a monthly informational webinar. And this is done by the by NBCMI about the CMI exams. And there is another slide for CCHI because they also do the same thing. The candidate handbook, and then a link to a page about getting prepared. But what I do want to take a look at with you is some of the same things that we looked at with the CCHI at their website. So here is going to be the breakdown of the written exam. So here you can see that the written exam, which is the CMI Hub, or the HubCMI, is going to be 8% roles of the medical interpreter, 15% medical interpreter ethics, 8% cultural competence, and 38% medical terminology in working languages. So that's going to test you with medical tests and diagnostic procedures, medical apparatus, pharmacology. So these are the topics that you can expect to see questions about when you are taking the medical terminology portion of this exam. Okay, 23% is going to be medical specialties in working languages, 5% interpreter standards of practice, and 3% legislation and regulations, such as HIPAA and CLAS, which we will touch on in this course. So over on page 13, we can also read about the cost. So the cost is $275 for the oral exam. For the written exam, it's going to be $175. So let's take a look at both exams side by side and compare some of the information that we learned. So the CCHI is available in Spanish, Arabic, and Mandarin, where the NBCMI is available in Cantonese, Korean, Mandarin, Russian, Spanish, and Vietnamese. And so at the beginning of this lecture, in part 1, I mentioned that there are certain things that you're going to have to consider when you try to pick which exam you want to take, such as, is it available in your language? And so this is going to be some of the things that you're going to consider, right? So is it available in your language? The written exam, for example, you want to take a look at that as well. And so in the case of the CCHI, you're looking at 100 multiple choice questions, 15 that are unscored. So your score is actually depending on answering 85 questions. The reason why they actually have you do those 15 extra questions that are not scored is because they're piloting questions that might possibly be in the new exam when it gets revamped. So you're going to answer 100 multiple choice questions. Your score is going to depend on 85 of those questions. You're going to get 120 minutes, so 2 hours to complete the exam. The total fees for the CCHI are $533, and that includes $40 for the application fee, $191 for the cost of taking the written exam, and $302 for oral performance exams. And that's going to include either the language-specific exam or the E2E. They both are $302. On the NBCMI side, we see that the written exam is also going to be multiple choice, computerized, just like the CCHI exam. But in this case, it's going to be 51 questions, and you'll have 75 minutes to complete the exam. So both the exams are multiple choice on a computer. The total cost for the NBCMI exam is going to be $485 for the total. So that's going to include $35 for the registration fee, which is almost the same thing as the application fee on the CCHI side, $175 for the written exam, and $275 for the oral exam. And the test in the case of the NBCMI exam is delivered at a designated testing center, and CCHI, you can take it at a testing center, or you can also choose to take it from home following certain regulations. All right, now a little bit more. Let's compare each a little bit more. So all CCHI exams are renewed every 4 years. So your certification, your CCHI certifications, that's going to be your CHI, your core CHI, your core CHI performance, they are all 4 years in length, so they need to be renewed every 4 years. Every 4 years, in order to renew your exam, you have to complete 32 hours of continuing education, and there is a renewal fee of $300. With NBCMI exams, the HubCMI is renewed every 4 years, and the CMI is renewed every 5 years. So if you took the CMI because it is available in your language, then you have to renew it every 5 years. The HubCMI here, as I said, is every 4 years. However, if you took the HubCMI, you can have HubCMI certification even if there is language-specific testing for your language, even if you speak one of those 6 languages, but it is only good for 2 years. So what they're saying is you have 2 years from the time that you take the written exam to take the oral exam and become CMI certified if the exam is available in your language. So if you speak Spanish, Korean, Vietnamese, all the languages that you heard me mention, the 6 that you heard me mention, you could take the HubCMI, have it for 2 years, but within those 2 years you have to take the CMI exam that includes the oral exam. Okay, the CEU requirement for the NBCMI exams is 30 hours, and the renewal fee is $300 as well. So again, you're going to consider all of these things and then choose which one is best for you. Part of your portfolio that you will be completing in this course is going to require that you actually take a look at the exams and decide. You don't have to decide and commit now, but you are going to be asked to answer as of now from what you have learned so far, which exam you're going to take and why. So make sure that you do watch this presentation, consider all of the differences, the comparison between the 2 exams, and make an educated decision as to which exam you would take. Again, it's not a binding contract. If you graduate and then you say, you know what, I said this one in my portfolio, but I'm actually going to take this other exam, that's fine as well. I just want you to start practicing, sort of thinking about which exam might be better for you, considering all the information that you have learned. Both certifying bodies hold and keep up a registry. This is where someone can check your credentials. So for example, if you go to apply for a job, or you are going to do certification, or you have to provide proof of certification because you're going to be doing workers' compensation, things like that, you will receive your certification, your certificate and proof of certification, but your employer is, or whoever you contract with, is going to want to check your registration to make sure that your credentials are valid, and so they both offer that service. So this is the registry for the NBCMI, and this is the registry for CCHI, and all you have to do is type someone's name. You can type the city or state. In this case, it looks like it's populating Sacramento because we're in Sacramento. Let's take a look at what happens there. There we go. And that would be one way. And then it's also a way for you to download your letter. So if you misplace it, so this would be something that you can show as proof if you don't want to send your actual certificate. This might be more appropriate. Alright, so there's the information. Of course, I'm going to also have the links to the handbooks for you to investigate a little bit more, and I do want to encourage you to take a look at those. Maybe not immediately. I know we are early in the process. You're not going to go and take the exams yet, but it's still a good information for you to have.